Why do people struggle with neck pain even when they exercise?
Many people struggle with neck pain even when they exercise because the underlying problem is not a weakness problem. It's not a muscle problem. Many times the underlying problem is an alignment issue. For example, if your head is too far forward, or if it's shifted to the side, or if the joints themselves are locked or stuck, it doesn't matter how strong the muscles are in the spine, it's not going to correct the underlying problem until the spine is brought back into normal position, whether it's a forward head shift going back to neutral or a side shift going back to neutral, or if it's a stuck bone that can't move. Until that motion is restored, the underlying problem is not going to be addressed. So that's why so many people continue to have neck pain even if they're exercising.
Should neck pain resolve on its own?
In most cases, neck pain should resolve on its own because our bodies are self-healing and self-regenerating. So in most instances, neck pain should resolve on its own. So there are a variety of reasons why neck pain wouldn't resolve, and one of those reasons is if the underlying ligaments in the spine are damaged. If the ligaments that hold the bones together have been overstretched or torn, then in most instances that neck pain is going to be recurring. Other examples of why neck pain would not resolve on its own: if there was a substantial postural imbalance, that postural imbalance will put stress on the ligaments, on the joints, on the muscles, the tendons. There might be periods where the pain goes away and then it would come back. So those are examples of why neck pain would not go away on its own. Generally, it should go away though. Our bodies are designed to heal.
If a patient comes in with neck pain, how do you determine what that is coming from?
When a patient comes in and they have neck pain or any other type of pain, the main goal, especially on that first visit, is to try to figure out what the underlying cause of that pain problem is. And how is that done? Well, it's really, there isn't a simple answer to it. It's a bit of an art. And one of the most important things is it's listening to the patient and looking for clues and patterns that would reveal what the underlying problem is. Things that make it worse, the condition worse, make things that make it feel better, the time of the day, different types of activities. So after spending some time listening, looking for patterns and clues, then usually the next piece is called palpation. So palpation is when I use my hands and I put my hands on the person's back and I'm feeling for the alignment of the bones. I'm looking for movement patterns. I'm looking for tension within the muscle, tightness. That gives me a lot of information. Oftentimes I will feel what the underlying problem is just with palpation, and I'll correlate that with things that they've told me. Sometimes though, that's not enough. Sometimes it's not obvious even after palpation and talking to the patient. So then at that point, a lot of times I'll look at posture. If someone's posture is shifted out of alignment, if they're out of plane, if they're rotated, if their head is forward, all those types of things can create the neck pain or back pain, or can create all types of symptoms that bring people into the office. So really carefully looking at their posture, doing other special tests that put stress on the spine to try to provoke the symptoms are really helpful. Like for example, with neck pain, sometimes the pain is coming from a pinched nerve, and well, one of the ideas is, well, we want to try to provoke that and try to reproduce the symptoms. So we're going to do different types of tests to put stress on that joint, put stress on that nerve, to see if we can exacerbate or kind of provoke the symptoms and try to reproduce it. That's going to give me clues. Is it coming from the nerve, or is it coming from a muscle? So do a series of tests like that. Another really important tool is X-ray. Even with all those tests that I just described, sometimes it's still not obvious, and that's why X-ray can be really important, because you can really see if there's any underlying damage that you can't feel, that you can't evoke from tests. You can see the spacing between the bones. You can see if there's old breaks in the bones. You can see patterns of misalignment that you can't otherwise feel or see when you're looking at their posture. when trying to figure out what the underlying problem is, it's a lot of problem solving and thinking through things really critically. There isn't like one test that tells me what the underlying problem is. It's kind of a series of tests and trying to put it all together and looking for common denominators that would best help understand, explain what that underlying problem is.
What's one piece of technology that can help people with neck pain?
Yeah, one piece of our equipment, office equipment, that we use quite a bit to help people with neck pain is this cervical decompression machine. So oftentimes with neck pain, what happens is there's quite a bit of compression this direction in the neck. What that does is it puts pressure on these joints, on the discs. When it's really severe, it can cause the nerves to become irritated, causing not only neck pain, but radiating arm and shoulder pain, numbness and tingling. So with the cervical decompression machine, what happens is that the spine goes like this. Patient's head goes in this position. So head is right here. You can program in the amount of tension that you want. And what that machine does is it pulls and oscillates back and forth like this. And what it does is it creates separation on these joints, reduces swelling, reduces inflammation, and it can help quite a bit with neck pain.
All right, why does precision matter when caring for the neck?
Precision matters when treating the neck because the neck has many delicate ligaments, and when these ligaments become stretched or torn, it's not uncommon to make a patient worse if the wrong exercise is given or if the wrong treatment is being used. The types of neck pain cases that we're particularly good at helping with are people that have a postural component to their neck condition. So what I mean by that is a forward shift with the neck like this, or a side shift like this, or another type of imbalance is a reversal in the cervical curve like that. So any type of postural or misalignment, spinal misalignment that's causing the neck problem, we're particularly good with at helping.
People with postural neck pain problems, what kind of feelings and symptoms bring them into the office?
People that have a postural problem that's driving their neck pain can have a variety of symptoms. It really depends upon where on the spectrum they are in terms of this postural problem, how long it's been there, and how severe it is. So a small problem when the person is relatively young isn't going to be a big issue. It doesn't create a lot of symptoms. Could be relatively mild, but that same postural problem that's been there for 40 or 50 years could really create a very severe problem, severe symptoms, causing compression of the disc, herniated discs, significantly interfered with nerves, altered nerve function, pain going down the arms, intense headaches. So these types of postural problems, they can really create a variety of symptoms, really depending upon how long has it been there, and also how severe is the postural problem. If you've been experiencing chronic neck pain or back pain or any type of pain, you've seen lots of other providers, and you're still struggling with it, and it seems like it's not getting any better. One reason why this happens is because the true underlying cause of the problem still hasn't been found. Once that underlying problem has been found, then the correct solution, the correct treatment plan can be applied to that problem. The body is designed to heal. It's designed to regenerate on its own. Health is its natural expression. So if the underlying cause can be identified in a treatment plan built around at getting to that root cause, most of the time patients do experience quite a bit of relief. If you've been suffering chronic neck pain, if you've seen other providers and you're still experiencing these symptoms, I invite you to come into my office.